Hey guys, long time no see. I hope you guys have all been staying super safe during this time. I know a few of my subscribers have reached out to me and told me they've been exposed to or contracted the virus. Some have been exposed to and been quarantined for days at a time, and unfortunately for them, a lot of companies aren't paying for the time off. I hope that's not you, and I hope you guys are all taking the proper precautions and that you're provided with everything you need. It really is just a crazy time in the world and really in EMS. It has been forever since I've had just a sit down chit chat with y'all. Honestly, I've experienced so much growth over the last, I'd say 3 to 6 months. And so I wanted to connect with you guys a little bit more and give you the opportunity to send me questions, and I'll respond to them. Let's get started. If you like EMS related stuff, make sure to hit the subscribe button down below. And while you're down there, hit that little notification bell, and this will just tell you when I post a new video on my channel. Okay, so last week I posted on my Insta story that I was going to do a Q&A and give my new followers just an opportunity to ask me EMS related stuff or stuff about me. And you guys, of course, as always, never disappoint. Let's jump into some of the questions that you sent me. And just a quick disclaimer, I will tell you that there were a few questions that I won't have in this video, and that's mainly because they need more than just a minute on a video to explain. If you don't see your question on there, it's probably because I'm going to dedicate an entire video to it. The first question is, where do you work? In the United States of America, and I work and am employed with a fire department. I do have part-time EMS jobs at times throughout the year, but my main job is at a fire department. Okay, question number 2 is, what should I focus on when I'm studying for the Nremt? And you're probably going to hate this answer, but absolutely everything. You need to study everything in the book, but I will go over things that you have to for sure know and understand before you enter the National Registry test site, or at least you should. So let me go over that, and this is in no particular order. CPR and why we do it, the blood flow and the anatomy of the heart, signs and symptoms of your medical conditions and your traumatic injury, Beck's triad and Cushing's triad, what's the difference between the two and what do they indicate, anatomical positions, an understanding of the medications within your scope, the drug classes, what they do in the body, the mechanism of action, contraindications, indications, etc. Mnemonics like sample, AVPU, OPQRST. You need to know what they mean and when to use them. The stages of labor, APGAR and GCS score, respiration, oxygenation, ventilation, the anatomy of the upper and lower airway, a basic understanding of DNRs, radio communication, and scope of practice, like what it means, what it entails. So just so you know, that is just scraping the surface of what you need to know when you go into the National Registry test site. Question number 3, what is the hardest part of this field? There are some negatives to this field, I'm not even going to lie to you, but in my mind, the positives of this field outweigh the negative. I will tell you, basically any call having to do with a child is nerve-wracking, and it's something that EMS providers and people in general have a hard time dealing with. And trust me when I say, when you go on a scene with a baby or a child that, heaven forbid, is in cardiac arrest or is severely injured or something else more serious, the tension is at an all-time high. Everybody on scene, typically from the highest rank to the lowest rank, from the most experienced to the least experienced, like everybody's on edge. There's something about a child getting hurt or being ill that really it's just awful. Even the cardiac arrests that you go on that are young adults, which are typically pretty sad, that they don't hold a candle to a child. That is probably one of the hardest parts of this field. Another part is when you've left a call or a scene knowing that you could have done more or that you should have done something different. Everybody will tell you, oh, don't beat yourself up, don't question yourself. And yeah, while that's true and you don't want to do that, we're all human, right? Questioning yourself in general after a call just sucks. And I know that people will be able to agree with me on this, but I personally work 48-hour shifts. The lack of sleep that I experience sometimes when I'm on shift, it's hard. And I know for my coworkers, it's difficult as well, because a lot of them have children and they go home and they have to function like they haven't been sleep deprived for the last 48 hours. Also, the being jolted out of sleep. A lot of times I don't get into a deep sleep when I'm at work because I hate the feeling of being jolted out of sleep when I'm in a deep sleep. I've had calls where I've fallen into a deep sleep before, the tone goes off and I'm shaking still 5 minutes later. It can't be good for you. So yeah, those are some of the hardest parts of this field. Question number 4, how do you remember everything you learned and apply it to your patient? The answer to this question is a lot of times you don't. That is why you lean on having a great partner, a great crew. A lot of times in EMS, you'll get tunnel vision where you start focusing on something and you'll forget other things. And that is when it's time for your partner or your crew to step in and say, hey, why don't we check pupils? Hey, why don't we check a BGL, etc. That's how we have each other's back. But we can eliminate a lot of mistakes by developing a really thorough routine. The biggest way to combat this is by asking a ton of questions. Always getting your sample history, not forgetting to ask OP QRST, doing your physical assessment from head to toe, and this includes checking pupils, listening to lung sounds, getting vitals, etc. If you get into the routine of being really thorough, even on patients that it's not necessarily needed, it will eliminate a lot of future mistakes. Question number 5, how can I get better at BP and pulse? So I'm assuming that this means that the EMS provider that wrote in wants to get better at checking blood pressure and checking pulse. If you're talking about manual blood pressure and pulse, the best thing that you can do is be practicing all the time. Practice on your partners, all of your patients, like every single one of them, on your family, on your friends. Use anybody willing to let you practice on them. Practicing will make you better and eventually it will become your routine and something that you're a lot more comfortable with. Question number 6, what do you do if you really can't tell the patient's respiration? So I don't know if the person who wrote in meant that they're trying to count the patient's respirations but they're too fast or too slow and they're having a hard time, or maybe they're having a hard time counting them because they're going down the road in the chaos of code 3 to the hospital. But whatever it might be, I would suggest to continue to try. Use your partner if they're available. Having another set of ears always helps. If it's because of the chaos of the ambulance, throw your stethoscope on and try and get your respiration count that way. Something that I do, like in cases of seizures, difficulty breathing patients, unconscious, unresponsive, overdoses, is I put the end tidal on. And this not only gives me a value for my end tidal, but it also gives me a number of respirations per minute. So that's just another option that you can do if you're faced with that problem. Question number 7, do you use CPAP to stabilize flail chest? I have read some studies that have talked about using CPAP over BVM for flail chest patients, but it is not in my protocol. I was not taught to do that. And to be perfectly honest with you, in my protocol, chest injuries such as flail chest, CPAP is actually contraindicated. I would take a wild guess and say whoever wrote this question, it's probably contraindicated in your area too, but that's why it's always so important to learn your protocols. Question number 8, which course do you recommend after completing your BCSC in paramedicine? So I'm assuming that that's probably your bachelor's degree, and like the sky is the limit from there. You can get your critical care medic, you can go into flight medicine after a few years ground experience, you can take your classes to become ACLS, PALS, CPR, PHTLS instructor certified. So not only will you carry your certification in this, but you can also be certified to become an instructor, which takes certain classes. Also, you can keep going, you can bridge over to RN with the medic to RN bridge program, or go to nursing school. You can become a nurse practitioner after that. You can also go down the PA route, which is the physician's assistant. Honestly, there's a lot of people who have become medic and they've just taken tons of courses like I've just listed, not necessarily the NP or the PA route, but other courses in paramedicine, and just become more specialized and more knowledgeable in their field and their scope of practice, and there is absolutely nothing wrong with that. Question number 9, what is the management of DKA in the pre-hospital setting? Obviously, this depends on your patient, your protocol, what you carry on your ambulance. Looking for an underlying cause is always important, so you may start off with that. My department and most EMS services that I know, they don't carry insulin. So personally, if I were faced with this situation, I would manage the airway, monitor respirations. I would also hook them up to end tidal, monitor my O2 saturation, obtain a 12 lead, gain IV access. And I'm sure you guys have heard this saying, but since we don't have insulin on the ambulance, the saying that we go by is the solution to pollution is dilution. So in in these cases, we would start a normal saline drip. This is obviously patient dependent. A lot of our diabetics also are in kidney failure on dialysis. These are not the kind of patients that you want to overload with fluid. If they are good candidates, I will give them normal saline to hopefully bring that BGL or that blood glucose level down a little bit. Then I'm going to reassess the BGL, vitals, and also the underlying condition. So that's what I would do on my side. But a lot of times after we drop these patients off at the hospital, in some serious cases end up giving sodium bicarb, potassium, and sometimes even magnesium. But this just depends on the patient's condition, situation, lab values, and sometimes even just how the doctor wants to handle it. Question number 10. How do you crush internship? Asking for a friend. Coincidentally, I have done a video all about crushing your paramedic internship. So I will link that up here. I encourage you to click that link and go watch that video. Question number 11. Why don't you do more cardiology stuff? Like, I watched one of your videos called Tachy Tuesday. More stuff like that, please. I like your medication Mondays too. They help so much. Thank you. First of all, thank you for watching those medication Mondays. I put a lot of work into them. And as for the Tachy Tuesday, so I've actually gotten a lot of questions about why I don't go into cardiology more. And to be honest with you, I'm about to start. Not only is it something that a lot of paramedic students struggle with, it's something that I struggled with a lot, and it would actually really benefit me to review and to just go over this with you guys. Definitely keep a lookout. Question number 12. I have followed you for years, and you used to have so many other videos up when you were in paramedic school. I found them so relatable and real. Why did you take them down and disappear for so long? First of all, thank you for following me so long. That was a really long time ago, and it has been quite the journey. I had a ton of videos up before I restarted this channel, and I want to go into that in a totally separate video, so stay tuned for that. I'm going to talk about why I took the videos down, what they had. All right, question number 13, and a question that I get every time I put out a Q&A, and that is, are you married? Yes. I am married. I have been for going on 9 years now, and I would not trade it for the world. There is nothing better than coming home to your best friend and your husband after an exhausting shift or whatever. Getting to spend your life with your best friend. My husband is not EMS affiliated. Well, I guess he is kind of EMS affiliated in a way because I constantly talk about EMS, so I'm sure he knows more than the average Joe. I am totally okay with him not being in the field. That doesn't bother me a bit. I just feel blessed to have him. I mean, marriage is hard work, but it is so great and I love it. And that's about it for questions today. If there's a question that I didn't answer that you would like answered, make sure to drop it in the comment section below and I will include it in my next video. If you like this video and you want to see more like it, make sure that you hit the like button down below. That helps me tremendously on YouTube. And also share it with all your fellow and aspiring EMS junkies out there. Until next time, guys, thank you so much for watching. Bye.